Okay, hi everyone. So today I'm speaking on behalf of Lanta Animal Welfare. We're a small charity based in the south of Thailand in Krabi province. Our primary aim is sterilisation and rabies vaccination, though we do also operate a very busy veterinary clinic. We're the only clinic within a 3 to 4 hour journey, as we're 2 hours away from the mainland, 2 ferries away from the mainland rather. And we also provide a veterinary outreach service to several remote islands in the region, which otherwise wouldn't have any access to veterinary care. We also have at the Lanta Animal Welfare Centre a small number of adoptable animals, although sheltering is definitely not our focus, and numbers are kept to a minimum to ensure that we maintain a far higher welfare standard than those typically found in Southeast Asian shelters. So today I'll be focusing on a campaign of targeted rabies education material on Koh Lanta. The myths I'll talk about today and the education material are very location specific and take into account the cultural considerations, the demographic and the resources where the actual campaign began in the latter half of 2014. But the principles are transferable to other locations. Okay, so as a brief country-specific background, rabies is endemic in all regions of Thailand, with cases being the highest within the cities where both owned and stray companion animals populations are high, and in other areas where resources are readily available. There's been a dramatic decline, thankfully, in both human and canine rabies cases over the past 20 plus years, as both the graph from a study by Mitmoonpitak et al. And WHO data shows, and reference for these are at the end of the presentation. So the WHO notes that there were 170 human rabies mortalities in 1991, which dropped down to 8 in 2011, which is excellent. And this is thought to be partially due to higher availability and lower cost of both human post-exposure prophylaxis and canine rabies vaccinations. In 2011, central and southern areas had the highest human rabies mortality rate, and Koh Lanta is in the far south. The annual rabies mortality rate in Thailand is 0.12 per million people, which isn't a huge figure, particularly if you compare this with other countries in Southeast Asia and Asia in general, but it's still too high considering that these deaths could have been prevented. There's also the economic situation to consider. One study on cost-effective rabies vaccinations found that when you use the Thai Red Cross schedule of 5 PEP treatments, each course costs a minimum of $45 US. And that's almost 5 days' work at minimum wage in Thailand, and the poorest don't even meet the minimum wage standard. So the most vulnerable people can't meet these costs, and on a larger scale, rabies cost the governments in Asia an estimated $563 million US annually. So giving accurate vaccination information could further reduce the economic cost at a national level and encourage larger provision of free or heavily subsidised vaccinations for those most in need. In terms of numbers, although we know the reported figure for human rabies cases, again, the numbers of rabid dog cases within Thailand are likely highly underestimated, as suspected cases will go uncounted if post-mortem brain tissue testing isn't possible, or if locals, again, take matters into their own hands and kill the dog before it can be reported. So, a 2011 study by Chuxnum et al. Reconfirmed that dogs are still the main rabies reservoir, with the highest rate of infection being found in pups under 12 weeks. The most significant part of this study, though, was that the majority of human rabies cases in Thailand were not caused by stray dogs. They were caused by owned, unvaccinated dogs, which is obviously different in several other countries. And this has changed since previous studies where community and stray dogs were held responsible, and back when pet ownership was at a significantly lower level. If you break it down further and focus on bites in children, as Sri Arun et al. Did in 2006, as on the graph here, Owned animals were responsible for more bites than strays, and unvaccinated owned animals were almost as likely to bite as strays. So although owned unvaccinated dogs might not be the main rabies risk in other countries, for an education programme in Thailand, encouraging vaccination of owned pets was noted as a priority, as was the management of pups under 12 weeks old. Despite most bite cases stemming from owned unvaccinated dogs, it seems that the concern about transmission of rabies from street dogs is far higher than transmission concern from pets. And where this misconception is in place, the reactions of locals to an aggressive dog is extremely negative, particularly if children are involved. A lack of understanding about the causes of aggression and dog behaviour often leads them to jump to conclusions, which results in the inhumane killing of the dog in question. It's automatically moving my slides, which I don't like. So looking at the myths, so there are a number of cultural myths surrounding rabies which are present in Thailand, and these are the main myths as identified by the Thai Public Health Permanent Secretary back in 2006. So rabies is only spread in the hot season. Bites can be treated with tiger balm or tobacco. Slapping the bite wounds, particularly with a sandal. Sprinkling holy water cures rabies. Eating the liver of the dog that bit you will prevent transmission, and if you don't want your own animal to be infected, cutting off the dog's ears and tails is seen as a way to prevent this. Pregnant women cannot be vaccinated against rabies or treated against it after a bite, and there's a definite overestimate of post-exposure vaccines needed. So these were the myths back in 2006. But to identify whether these myths were present on Koh Lanta now, 8 years later, I carried out a survey of the local community here on Koh Lanta and handed those out to people visiting the clinic. We'd have loved to survey on a door-to-door basis, but unfortunately we don't have the staff or resources to be able to do that. So we had to go with a more feasible option for our project. So the survey was a simple list of statements about rabies translated into Thai, about rabies transmission, prevention, action after bites, etc. And it asked those surveyed to tick whether the sentence was true, false, or whether they were unsure. Prior to this, we had a more complicated survey using a 5-level Likert scale, but feedback from locals and our observations suggested they would respond better to a simpler one, and this also meant that we didn't have a reception full of people holding an impromptu discussion group about which answer they've ticked, and oh well, I'll put the same answer as you. So when we simplified the survey, that stopped that from happening. And we also asked a range of demographic questions, including the level of education, and more importantly, whether they had children in the local schools. Unsurprisingly, the findings from the 351 surveys completed throughout April and May last year indicated a poor knowledge of both canine behaviour and of rabies. 45% of those surveyed thought that a bite from an animal meant that it must be rabid. Regardless of the situation where it bit, it must be rabid. Or they were unsure about this. And 46% thought that even if their animal was correctly vaccinated against rabies, it could still catch and transmit the disease, or they were unsure about this. Unfortunately, the hot weather myth is still prevalent. Around 25% of people thought that that was still the case, and a knock-on effect of this myth is that many Thai vets, who should know better, are still unwilling to do ABC clinics in the hottest months, as they believe that they're more likely to encounter a rabid dog during those months. And this is the vets, so you can understand how it's difficult to get things done sometimes. Also, 20% of locals thought that up to 20 PEP treatments were needed after being bitten. Thankfully, some of the 2006 myths are not applicable on Koh Lanta. As the island is predominantly Muslim, the locals would never dream of eating a dog liver, and most wouldn't touch a dog in the attempt to cut its ears or tails off. So thankfully, we didn't need to combat those particular myths. And similarly, the application of tiger balm or holy water to bite wounds wasn't a relevant myth on Koh Lanta, though they may still be applicable on the mainland. So, with the previous information in mind, the first key issue to tackle in the education programme was the vaccination of owned companion animals. Thankfully, on Koh Lanta, owner uptake of rabies vaccination is very good, mainly because it's offered free of charge alongside sterilisation, and anything that's free in Thailand is usually very well received. Outside of Koh Lanta though, in other rural areas where rabies vaccination access may not be as readily available, this should be a key target point. But for this particular specific community, this point features more as a reminder than a main message. The key points for this campaign centred around correcting the misconceptions highlighted in the myth survey and bite avoidance. Responsible behaviour around dogs is also very lacking on the island, as is rabies background knowledge in general, as health knowledge is poor on the island, both in terms of human health and animal health. Advising people what to do if they come across an animal they suspect has rabies was also very important, and in a worst case scenario where the animal bites, giving accurate advice on how to deal with this is crucial. We do have a hospital, it's not very good, but we have one, and a few small clinics on the island, so access to post-exposure treatments is possible on Lanta, but urging immediate washing of the wound followed by a trip to hospital needed reiterating, because we do have anecdotal reports of people waiting several days. As a key Thai study showed, 55% of Thai animal bite victims were children, which is one of the reasons why we focused on the 9 small schools on Koh Lanta. So, after taking into consideration the limited resources on our island and in our charity, we created the education material, and one small part of the campaign was an interactive quiz. It's an activity that was designed to be fun, interactive, and plays to the Thai love of technology whilst being educational. In terms of barriers, there are both cultural and practical issues to deal with. Practically, there's no point building a state-of-the-art multimedia quiz for use on Koh Lanta, particularly when the power cuts off every few weeks. The internet connection isn't always reliable, particularly in monsoon season. Not all schools are internet ready anyway. So to overcome this, as well as the hard copies of education material, the quiz itself was designed as an offline, internally hyperlinked PowerPoint activity. So that works on old versions. So the computers the schools currently own were capable of running it without any problems. Culturally, on the island of Koh Lanta, as mentioned before, the Muslim population is extremely high, around 95 to 98%. And as such, understanding and tolerance towards dogs is already quite limited. Although this behaviour is changing and improving over the years, particularly since Lanta Animal Welfare was founded back in 2005. Despite that improvement, given the religious concerns, the education programme had to be careful to be factual. After all, dogs are the main rabies reservoir and bite culprit, but without demonising dogs further. So for this reason, though dogs are focused on in the interactive quiz, particularly in questions about behaviour around dogs, they're not blamed as being responsible for rabies. Other mammals are mentioned, and more importantly, the quiz and other education material describe how human and community actions can prevent the spread of rabies through vaccination and reducing free-roaming pets. And again, it's part of a wider educational campaign and was created in several languages to maximise impact on the island. So, as well as a Thai version, which I'll talk about more shortly, there's an original English version, as there's a small but very vocal English-speaking expat community on the island. Oh, sorry, it's doing it on its own. So the quiz is arranged so that clicking on a correct or incorrect answer will take you to a specific response page. So in the schools on Koh-Lanta, the classroom age varies greatly. So instead of 8 to 9-year-olds in a class, for example, you might have 8 to 12-year-olds. And obviously this makes age targeting challenging, and to try and combat this, we aimed at an intermediate level, so this could be paired with relevant age-related activities, so whether that's drawing for younger children or role-playing for older ones. And this is an example of an intermediate one. Okay, so we also have a Swedish version. The Swedish people actually outnumber the English speakers on Koh-Lanta, so we have a Swedish version available for use in the 3 Swedish schools. And of course we have the Thai language version. Okay, so you can see here that this version contains an image of a dog, but we also have a version without photos of dogs. Most of the schools are mixed religion, but there were a few where we were asked that the material did not contain images of dogs. Although this might sound quite strange when dogs are the main target species, we agreed, as we believe it's better to have education where references are purely text-based rather than no relevant rabies and animal welfare education. Also, the community on the island is very close-knit, and we have no desire to alienate any of the schools by not complying. So hopefully this will click once. So one main feature to note is that students can never navigate the quiz without finding the correct answer. And for questions where it's important to tell the students why their answer is wrong, custom slides were made with more information in the feedback. So for example, with the question, what should you do if you think an animal has rabies? If the child clicks try to hurt the animal, then they'll progress to this slide. Also, whenever they get a question wrong, there's always the opportunity to try again, or to click and find out the correct answer, so the kids don't get frustrated with it and ultimately leave knowing more. So the interactive quiz covers a range of material here, as identified in the myth survey. In terms of implementation, Sri Aruna et al.'s study on bites in children found that bites rates within Thailand peaked during 2 periods corresponding to school vacations, and the highest peak was in the month-long break in October. So in order to maximise the impact of the campaign, it was scheduled to first begin in school 1 to 2 weeks before the start of the October break. Okay, since the break, we've been doing monthly visits at each of the schools. We're very lucky in the fact that the curriculum in the schools in Thailand, well, on Koh-Lanta, are very loosely adhered to. It probably seemed quite lawless if you compared it to a Western school, but in terms of allowing us regular access to give animal welfare and rabies classes, this really works in our favour. And the children always respond positively, and in general the teachers are very happy because they don't have to make a lesson plan. In terms of addressing the key issues I mentioned earlier, the quiz manages to do this on its own, but it's also accompanied by hard copies of the quiz, worksheets, dramatic presentations and workshops with the children to encourage fun and allow them to express what they've learned in a physical and theatrical manner. Okay, and the information featured in the campaign was also made available for the children to take home, helping to spread information further to their parents. And we also had rescue centre visits depending upon the religion. Okay, so here are just a few examples. There's usually around 50 students in a class. And these particular children started regularly visiting Lanta Animal Welfare after the education campaign began bringing their animals for treatment and getting our autographs, which was quite flattering. So, during the programme, we used the trusted test, teach, test method. So moving on to evaluation, as that's probably the most important part. From what we saw in class and from the teacher reports, the general knowledge and positive attitudes towards companion animals increased, but in order to assess whether the material successfully filtered down to the parents, the original rabies belief survey which was used to identify the current myths, was distributed again throughout February 2015 and is currently still being distributed. The exact results of the demographic questions are still being analysed, but the fundamental results are very positive so far. The February survey results showed that the number of people who thought that a bite from an animal meant that it must be rabid or were unsure about this has dropped by 16% from 45 down to 29. Similarly, there were reductions in inaccurate vaccination knowledge, the prevalence of the hot season myth, and incorrect PEP knowledge. Obviously, a more demographic analysis is needed as the surveys are continuing to be distributed, and there are some other factors which may have influenced the results. For example, the first survey was taken in low season, when many of the business owners who could feasibly be more educated returned to the mainland to work. And the February survey was taken in high tourist season, where perhaps more of the educated types have returned, which is why we're continuing to assess the material and to keep surveying. So, although these factors might have influenced the February results, we hypothesise that the results should still show that the education material has filtered down to adults and had an impact on rabies myth education on the island. From a cost perspective, Lantern Animal Welfare is a small NGO, and we pride ourselves on being able to achieve a significant amount on an extremely low budget. So the total cost for the education campaign was 1,000 baht or $30, which was mostly for print costs and a little bit of petrol for school visits. So everything else was done during working hours, so fell under normal staff salaries, and illustrations and translations were done pro bono. So from a cost benefits point of view, the benefits far outweighed the minimal costs, and we found that it is possible for a small organisation to create an effective, measurable rabies educational campaign on a low budget, targeting relevant rabies myths. Thank you. Sorry, Becky.